Hello, I'm Dr. Mabrie, and today we're shooting a video on dark circles under the eyes. We're going to talk about how to treat them, particularly using fillers both under the eyes and for cheek augmentation. We'll be looking at the anatomy using some 3D illustrations, keynote slides, and we'll also have a live patient demonstrating the technique. The under eye area is what we call the tear trough area, this transition zone between the eye and the cheek. And the shadows start off in mild cases as just dark shadows in the tear trough area. In more severe cases can become full circles under the eyes. And in very severe cases, the dark circles can actually become bags. And it looks like at first that you may need to take some of the fat out under the eyes. But what really needs to happen is we need to fill in some of the gaps where the skin doesn't have support. By augmenting the cheekbone and under eye area together, there are three benefits for the face. The first is the improvement of the tear trough or dark circles under the eyes. The second is an improvement or reduction of the nasolabial fold. And the third improvement is the augmentation of the cheeks, which gives the face better proportions and it can actually make the face look more attractive. One of the reasons that it's so dark here is that there's actually a shadow that happens because of the unevenness that's there. There's a depression that's there. And if we can make that flat like that, the skin is actually very reflective and actually now the shadow's gone away. And we're going to do that today using the micro cannula. Here's one of my patients that illustrates the point about the tear trough and the cheeks again. We've augmented her tear trough area, but in addition we filled this outer upper cheek area. And really in filling these areas together, we're able to make a smooth transition from the eye to the cheek and make the patient look both more youthful and more attractive. Okay, so we've done this tear trough area, and what we need to inject is this upper cheek area here. Chloe has a wonderful chin already, and so when we're done, her cheeks will match her chin. Is your eye feeling numb? Not too bad?
No, honestly, I don't feel anything. It just feels normal completely.
Okay, cool. So this is that tear trough area that had the depression here, and we've made it pretty flat now. And the next time we do it, we'll build on this a little bit more, and ultimately this whole thing will be smooth.
Oh wow, the eyes look so much better. That's crazy. I love it.
Awesome. And hopefully I've shown that when we're treating the under eye area with fillers, we are actually treating those two areas together, the tear trough and the cheek area. And what we're actually doing is contouring the face in an effort to make it look more youthful and more attractive. I hope the video was helpful, and thank you for your attention.